This is Dr. Aida Nguyen, and I'm a geriatrician with the Department of Geriatric Medicine at JAPSA. I serve as the course director and the facilitator for this series. And our purpose is to empower the healthcare providers in the community to deliver age-friendly healthcare. And so I see there's a number of people who've signed in here, so that's great. Okay, next slide. Okay, so about ECHO. This ECHO forum serves as a forum for mutual teaching and learning from experts and from each other on the front line. As the ECHO motto goes, all teach, all learn. So it's going to take all of us to create this community of sharing where we all teach and all learn. Next slide. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open it up for a time of discussion. We invite you to share any geriatric cases. It may be even on a topic not related to today's lecture. Our interdisciplinary team is willing to teach and share our collective wisdom with you. We only ask you to keep everything HIPAA compliant. Next slide. So everything has to be confidential here. All case presentations have to be de-identified, HIPAA compliant, and we are also creating a safe learning environment. So rather than negativity, shame, or feeling embarrassed that you don't know something, this is a culture of mutual learning and encouragement. Just a note that any ECHO consultations do not create or establish provider-patient relationships between our specialists and patients who are being discussed or presented in this setting. Next slide. Okay, this is just our calendar. We run this series on the second Wednesday of each month from 12 to 1 o'clock with continuing credits available for doctors, nurses, and social workers. This is our calendar for the next couple of months. We have March, we have substance abuse, and April, we have a geriatric approach to nutrition. And if there are topics you would like us to cover in the future, please let us know in the chat box and when you complete the evaluation forms. Next slide. Okay, a couple of Zoom logistics. If you move your mouse to the bottom of the screen, you'll find the chat box, the chat icon and the mute icon. Next slide. So if you click on the chat tool, please enter your name, discipline, and organization so we can have a record of who attended. And after typing the information, don't forget to press enter. Next slide. And also, if you move your mouse to the bottom, you'll see the mute and unmute buttons. Make sure that if you're not speaking, please press mute so that we don't hear extraneous noise. But please unmute when you want to ask a question or discuss. Next slide. Okay, about the CMEs. This CME activity is sponsored by the Hawaii Consortium for Continuing Medical Education, which is a joint venture between the Hawaii Medical Association and the John A. Burns School of Medicine. Nurses can also claim CE credit, and there is also 1 hour of CE credit for social workers from the National Association of Social Workers. Next slide. Just want to introduce to you our little hub team here. That's myself, and then we have Mary Gautam, and she can wave later on when she can have a chance. There you go. There's Mary. She is a retired nurse from the Hawaii Department of Health, and she has decades of experience in public health nursing. And we have Sarah Tompkison. Not sure if she's joined us yet, but she is. She's a licensed social worker with 41 years of experience in geriatrics, health, mental health, and long-term care. She's had many years at the VA and served at Halikuike, and she's currently part-time at the Central Union Adult Daycare Program. Okay, and then of course there's you guys, the audience, and if you weren't here earlier, you're invited to introduce yourselves by typing in the chat box your name, your discipline, and your organization. And if you're joining by phone, you can actually try to do that as well. But otherwise, you can speak up and unmute and introduce yourselves if you'd like to. And finally, I'd like to introduce you to our guest speakers. So today's topic is communication skills for the COVID pandemic, advanced care planning, and vaccines. And today's talk will be presented by Takeshi Uemura. And joining us for the discussion will be Jeanette Kujane from Kakua Mau. So both speakers have disclosed that they do not have any relationships with commercial supporters that could be perceived as a conflict of interest in the context of this presentation. So without further ado, I will let Dr. Uemura take the floor. Thank you.
Great. Yeah. Thank you, Dr. Wen, for the introduction. So I'm a faculty member at Japson Department of Geriatrics and also Division of Palliative Medicine. And I work for nursing homes in the hospices. Today I'm going to talk about communication skills for COVID pandemic. So let me put up my slide. Hope you see it. Okay. So I'm going to talk about this advanced care planning during this COVID. But also I know that we started doing the vaccine, and then I thought it's a great idea to talk about a little bit about vaccine from the perspective of communications. And then I did actually a couple of times the talk about advanced care planning, and then some of you may have heard of this presentation already, but just please bear with me. But the vaccine stuff is new. Okay. So objective of the describe. Sorry, let me remove this. Sorry. How can I go back? Oh, here we go. So describe the basic structure of advanced care planning amid the COVID pandemic and respond to patients and their families' emotion with empathic statement, and describe how to explore patients' value and list the key communication skills to address concerns or questions about the COVID vaccines. So why advanced care planning is important during the COVID pandemic? There are a number of patients who are high risk for becoming seriously ill if they get COVID-19. And then a decline of COVID-19 happens very rapidly, as many of you know, maybe in hours even. So need a conversation before this crisis happens. It's important. And the COVID-19 changed the situation in the hospital and nursing home significantly. I know their restriction might be changing also, but still, my understanding, the restricted visitor policy in hospital and the nursing home. And then still they can die, the patient can die in the hospital alone, even though they may allow some, visitation at the end. Also, they may get COVID while they're in the hospital facility. And the COVID-19 highlighted the importance of advanced care planning, and this can be used as an opportunity to start the conversation. So I know, the number has been decreasing in Hawaii as well. And then we started doing the vaccine. So we are in the late phase, I would say, in the COVID pandemic. But still, I think, it is important to have advanced care planning. And then again, so you don't have to restrict to just the COVID-19 stuff. But I think through this conversation, you learn how to do, true advanced care planning. So what is advanced care planning? So is it about the placing DNR order and then filling out post? No, it is a part of the conversation, but it's not the only purpose of this conversation. And then is it about presenting choices and then let them choose whatever they want? No, it's not advanced care planning. What is it? So it's a conversation about what matters most. And then based on this conversation, you can make plan that's aligned with their goals. Okay, so that's the advanced care planning. So it's not about filling the form, or it's not about presenting choices. So preparing for COVID-19, 3 things to know. It's from the Aria Den Labs. I still have trouble to pronounce their name, but it's a good tool. So you can go to their website and then take a look what they have. But they said that there are 3 things, important things to know to do advanced care planning in COVID-19. So pick someone to be healthcare proxy or surrogate or POA, whatever you call. But it is crucial to make sure the patient, especially in geriatric population, the patient has someone designated. Actually, now I have a patient who doesn't have, designated surrogate, and then having so much trouble, she needs a surgery, and then she has no family here, so it'll be trouble. So, why do they have capacity? It is important to designate, have a conversation, and then make sure they have designated surrogate. And the second, talk about what matters most to you, to patient, and I'm going to talk about that. And also, third, this is specific to COVID-19, but think about what you would want if you become seriously ill with COVID-19. So basic structure, so this has nothing to do with COVID-19, but the basic structure of advanced care planning, or sometimes it's called goals of care conversation. And then I respect this Dr. Nakagawa, and actually he did the ground round a couple of days ago for our department as well. But I think, so this is called 3 stages, and then he created this idea. But he says, so first, sharing the knowledge is the first stage. And then second, explore values and clarify goals. And then third, negotiating treatment options. And then the conversation should happen in this sequence, meaning the first stage, you should do this first stage, and then go to second stage, and then third stage. So I'm going to go over each stage and then also talk about what we can say about COVID-19. So first stage, sharing the knowledge. So you have to know about the patient's medical condition. So communication in advance before the conversation with other medical providers to be on the same page. Let's say if patient has cardiac condition, advanced heart failure, and then if you're familiar with that condition, that's fine. But sometimes, I don't know advanced technology to treat heart failure and how much available in this island. So I always communicate with the specialist to make sure that I know exactly what I'm talking about. And also, it is important to involve healthcare proxy, healthcare POA, and then also family members. And then when you start the conversation, you can say, I usually use, hope for the best, but also it is important to prepare for the worst, so that you don't scare patients, saying, they may wonder why you started talking about this. But I always say it is important to be prepared, and then so that's how I approach the conversation. And then you assess their understanding of the condition. So always start with asking them what they know. So I usually say, can you tell me what you've been told by other physicians? Can you tell me? And then you can gauge their understanding, their health literacy. Some people say health literacy, but it is important because sometimes they say, oh, I have this, centimeters of tumor, and then stage 2 first, and the blah, blah, blah. So they explain to you in detail. You may want to explain the things in detail as well. But if they say just, oh, I was told that I have cancer, and then I don't know much. And then you may wonder, okay, so how come this patient doesn't know that, she has stage 4 and then metastatic cancer? So it gives you a lot of information. So it's always important to ask their understanding first. And then after that, and also that you can know the emotional level. So if patient started crying or getting upset, oh, doctor didn't told me that I have this, but I don't understand. If patient get upset, there is an emotion behind this. So the emotional gauge is also important process when you're listening to their understanding. And then after that, you summarize and explain the medical condition. And then you don't, unless they're like a medical field person, the patient or family, You don't have to explain in detail. And then Dr. Nakagawa usually say 2 minutes rule, or other people also say 2 minutes rule, meaning don't talk more than 2 minutes to explain the condition. So you don't talk about like a pathophysiology of, let's say COVID, and then, you don't do that. And it is important because that will just confuse the patient and they evade the message. And then usually it's recommended to use headline, and I'm going to talk about headline in the next slide, what it is. And after that, share the prognosis. So it is important to share the prognosis unless it's not appropriate. And then usually it's about time frame, is it like weeks to months, weeks to months, or days to weeks, or hours to days, or also functional status. So it will become, most likely you'll become a bedbound or something after this COVID, so that you can tell them what you're talking about, because you'll be surprised unless you ask. They may thinking, even though they have stage 4 cancer, they may thinking about 5 years in the future or 10 years. You'll be surprised. So you have to share the prognosis, and it's crucially important. And then, so I said a headline. So headline is when you give information about serious illness, it is better to give in a short sentence, and it's called headline. And then what is headline? So headline is composed of information and meaning. And then information is also usually one line. So you are in the highest group. So I'm talking about now coronavirus, but you are in the highest group for serious complications from coronavirus. That's the information. So this means that if you get the virus and then become seriously ill, it is likely that you would not survive even with maximum medical treatment. So this is the meaning. So headline is composed of information and the meaning, and then that's how you deliver the information. And then you should stop after delivering the headline and then respond to emotion. So this is from Vital Talk. It's a great resource for communication skills. And then so they show you a lot of skills, and I took this slide from their website, lecture. But so how do you start the conversation? So I'm also hoping that we can talk about the coronavirus might affect your situation and what is important to you, so that we can give you the best care possible. Is that okay? Again, so they're using about the hope for the best, but to prepare for the worst. And I'm going to use this, and then go to prognosticate. And then what do you already know about how the coronavirus could affect your health? So again, so you have to ask their understanding first. And then may I share with you what I know? So, and then after hearing what they know, you share your information. But always, it's important to ask permission first. And then I'm really hoping that you stay safe, but also, headline. So we know that people who are older and that have health problems like yours can become seriously ill quickly and may not survive. The treatment that we normally use to try to help people live, like breathing machine, may not help. So this is the headline information and the meaning. And then this is how you do it. And then so once you deliver the news, there'll be emotion. And then it is very important to address emotion when you have goals of care conversation or advanced care planning. And then medical professionals tend to ignore emotion because that's not how we are trained in medical school and then in nursing school or other training. However, addressing emotion is the key in goals of care or advanced care planning. Conversation about serious illness can provoke a strong emotional response. As you've seen it, right? And then emotion can obscure information processing. You've seen patient who doesn't remember anything after they heard they had cancer. This is because of emotion. Okay, and there's stories about the COVID-19 pandemic already scared people. So I'm pretty sure it's going to provoke some emotion. Okay, and then do not go into the next step. of the conversation before you address emotion. So how can you recognize emotion? First, you have to pay attention. Okay, so you have to pay attention, and then you have to expect that there will be emotion after you, especially after you deliver the news. And then how do you pay attention? So pay attention to body language or how they speak, tone of the voice or speed of the speech. And then also sometimes the emotion is manifested as question. So this is very tricky. And then this is one of the pitfall many people can fall. So questions from patient family are often expression of emotion. So they may say, will I die? So rather than answering, okay, so your prognosis is this and this, and then this is the chance you may die, answer that question. Rather, it's better to say, sounds like you're scared, right? So they're asking this question because they have emotion. So rather than answering the question, you have to pay emotion behind this question. Do I need to change my post so that I can be on the machine again? So rather than, okay, the post, the rule is blah, 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 you may want to say, sounds like you're concerned about something. So can you tell me more? So this is how you address rather than answering the question. So this is very tricky. Why is my mom not getting better? Again, so she's not asking. She's saying, I'm upset, right? Or I'm scared. And then it may be better to address emotion instead of answering these questions, okay? And again, so there are acronym that's called NURSE, and then this is a great way to respond to emotion. So you can read this later, but the N stands for name. So usually you say, you sound concerned, or you look upset, something like that. So you name the emotion, and then doesn't have to be accurate. You say it, and the patient, if it's not true, the patient would say, no, I'm not upset, but I'm worried. They will tell you the answer, so you don't have to be 100% accurate. And also you can use understand. So I can imagine this is difficult news to hear. Many people in your situation may feel, so that you normalize the emotion. So to be sad is okay, to be upset is okay. So you normalize by saying understanding statement. And also you can use respect. I can see you really care about your mom. So also, this is very powerful. So if you use it, and I use this often. And also you can use support statement. We'll do our best, everything we can do to support you through this illness. So this is support statement. And explore, this is very important. So can you tell me more? Again, so yeah, so don't assume what they mean by the phrase they use. Usually it's better to ask them, what do you mean by this? Can you tell me more? And then you will be surprised that they will tell you something completely unexpected. So it is a very important tool. And then after you address the emotion, you can go to the next stage, which is to explore values and then goals. And then this is the core of the advanced care planning. So how do you do that? So you can ask, like, what is important to you? What worries you? What do you want to avoid? Or what ability is crucial? So these are the example, but yeah, so basically you ask them what's important to them and then what's the value, and then trying to obtain as many as possible so that, student or resident, if they do it, usually they stop after they get one answer. Oh, my mom, it is important for my mom to be active. Okay, sounds good. So let's talk about plan. Okay, so it's not okay. So there might be multiple values. So it's always important to ask them what else, and then once they say, okay, so I don't think I have more, and then you can go to the next stage. And then if you're speaking to healthcare product, the surrogate, make sure to elicit patient's value, not the family's value. What do you mean by that? So what would he say? So you can say this phrase. What would he say if we were here and then heard what we just discussed? And then so that, if you ask them, what do you want? Or what's important to you? to family, if you're asking to the family, they will tell you what's important to the family, not the patient. But their role is to advocate, express the patient's wish, because the patient cannot speak, right? So you have to use this word, and then there's a study in the past that showed this is more effective to elicit patient's value, not the family's value. And then summarize the value. So it sounds like this and this are important to you. Did I get right? And then example of the COVID-related conversation. You can read this later. I'm going to share the slide. But it's basically the same. What's important to you. And after that, you can negotiate treatment options. And then, so this is when the medical expertise, your medical expertise comes in. So if you're not a physician, I don't think you want to do it, but you can still explore the value and ask them what's important. But in order to combine medical expertise and then the value, you need medical knowledge. And then this is where the physician plays role. And then so weigh possible benefits and the burdens of each intervention by using your medical knowledge, and then do not ask yes or no question to each intervention, meaning, do you want to be intubated? Do you want research station? Do you want this and this? Okay, if you do that, I guarantee that you'll be stuck, okay, in the conversation. So don't do it. And then you make recommendation based on the value. So in order to achieve, sounds like it to be comfortable, it's important to you. And in order to achieve that goal, I would recommend hospice or something. So you make recommendation, and then which is very different from what you were taught in school. So negotiating treatment options in COVID conversation. As I listen, it sounds like what matters most is blah, blah, blah. Did I miss anything? And then recommendation. So given what I know about your medical situation and then what you said is important, would it be okay if I make a recommendation? So first, they always get the permission, and then list the plan, and then consider post framework for options. And then after that, you made a recommendation, always check in, right? Because I mean, this is about the patient. So how does it sound to you? And then if they say, okay, sounds good, and then you can document and then put in the form. So VitalTalk also gave us a framework that's called Calmer. And then that's useful to know how to initiate the conversation, COVID conversation. So check in, take a deep breath, and then how are you doing with all this? That's how you initiate. And then ask about COVID. What have you been thinking about COVID? Again, so this is the principle, right? So you ask first and then tell them later after asking their understanding. And then lay out the issue. So here's something what I want to prepare for. And then motivate them to choose proxy, because again, the proxy is important. And then after that, ask about what matters most. So what's important to you, and then expect the emotion, and then make a recommendation if it's appropriate. And then sometimes patient may have previously documented wish in the form of advance directive or post. If they have that, there are ways to address this. So so you ask the patient, do you remember talking about this form with your primary care physician? Do you remember that? And then if they say yes, that's great. And then is that still how you feel? You can confirm. And then if they say no, here's what I see in the document. So you can tell them, so here's the form, and then it says this and this. And then you can ask, is that still how you feel? And then if they say no, I don't remember, and then I didn't mean this and this, and then you can say, I respect that you're feeling differently. And then you address the emotion and then address why, Okay, and then using just a couple minutes to talk about vaccine communication. So VitalTalk also provide this communication skills for COVID vaccine. So you can go to website, and then they can you can learn about the some phrases that you can use but I'm going to show you some of the tips and the phrases. So these are the 5 tips they talk about in the COVID vaccine conversation skills. So first, start with open-ended questions that do not assume vaccine acceptance. Okay, so you have to always open-ended conversation and then to be neutral. And then acknowledge patients' concerns without judging. So this is very important. And then avoid criticizing the patient's information sources. Cite your experience and then we'll point them to high quality sources. And then show awareness of your status as a messenger, especially for people of color and member of other underserved groups. And then link vaccine acceptance to the patient's hope and goals. So I'm going to show you some of the example from the website. So first one, so they may say, I've been hearing about COVID vaccine. What do you think? Right, so they're asking question. And then you may want to answer, oh, I think the vaccine is great. But rather than that, they recommend this. Okay, so what have you been hearing? I'd be interested in how you see the positive and negatives. So what you see here is, again, so I told you before giving the information, it's always important to ask their understanding. So it's called ask, tell, ask. And then, so this is the technique what they're using here. So even though they're asking you a question, rather than giving them answer, you ask them question first, okay? So this is very tricky. And then unless you're trained to do this, you wouldn't be able to do it. But so this is important. So even though they're asking you a question, you ask them and then explore their understanding and the emotion first. And then how did they do it so fast, right? So the vaccine development. And then what they recommend to say it is that I realized that this is happening faster than everyone predicted. So having question is normal. Okay, so what they're doing right now here is using understand statement. So again, so pay attention to emotion and address emotion is always important. So here they use understanding statement to normalize, they're wondering, right? So they're saying wondering, about vaccine is normal. And then after that, the people who developed this vaccine have been working on vaccine for 2 decades. It's been in making for a long time. So rather than go straight to answer their question, okay, address emotion first. So that's what they're doing here right now. I mean, in this phrase. And I just don't trust vaccine, they say. And I have heard other people say that you're worried about the vaccine. Could you say more about your concern? Again, so what they're doing is using understand statement and then explore statement. Can you tell me more? Okay, so even though, if you were told that, oh, I don't trust vaccine, and that you may want to feel that to persuade this person, oh, vaccine is important, and it's crucial as a nursing home staff, you got to get vaccine. But if you do that, you'll be stuck. So don't do it, and then address the emotion first. So that's what they recommend. You just never know what the side effect will be. And again, so what they would say is, yes, it is true that there have been some effects, some side effect. The most common side effect is this and this. So again, so the first, you say, acknowledge, right? So there have been some side effect, that's true. And then you don't also say bad or however, so that's also important communication skill. So don't do that because it will create a conflict. So don't use bad or however, then just you say the fact, okay? And then lastly, the vaccine that we have is proven to be safe and that I have taken it. So, he's not trying to persuade this person, just say the fact and then stop. So that's what they recommend. And then if the patient say, I'm just going to wait, okay? And then of course, this is your decision. I do think the vaccine is a step towards a social life with fewer restriction. And then you mentioned that you want to visit your friends, and the vaccine will help you, and that all of us do that sooner. So what they're doing is, again, so first you gotta be neutral. in standpoint, then they're linking their vaccine with their goal. So aligning with the goal so that they will be motivated to do vaccine. So you mentioned that you want to go here, before. So I think the vaccine will help you. So that's how they approach, rather than just, oh, it's not a good idea, vaccine, virus is crazy out there, so it doesn't work. Okay, so take home message. So ACP conversation specific to COVID are important, especially for high-risk patient, and they share the prognosis, especially patient is high risk, and they explore values and make recommendation based on the value, and they respond to emotion is the key for both ACP and vaccine conversation. This is the source. And then if you have question later, feel free to email me. Thank you.
Thank you so much, Dr. Urimura. So I'd like to just kind of open this up and see if people have any questions. This is really timely, I think, because a lot of us are struggling with people who don't want to get the vaccine. Anybody want to share any of their challenges and see what we can think about as a group?
This is Sarah. Hi, Dr. Uemura. Thank you so much for your presentation. I know that we have been challenged, but through lots of communication with family caregivers here at the Adult Daycare Center, we actually were able to partner with Times Pharmacy, and last week successfully inoculated those adult daycare and day health clients here at Central Union Church. So definitely the communication is important. I really appreciated when you went over this topic of advanced care planning and communication, that it's important to document that conversation. I just wanted to add, what are your thoughts, doctor, about sharing that documentation with the client and the family, since it can be overwhelming getting that information on their diagnosis?
Sorry, you said a document or diagnosis?
So like when you have the conversation and you're explaining the diagnosis and you're answering questions, are you able to summarize and provide that information that's written to the client? That way it helps them remember what happened in the dialogue that you had, especially since you point out some people may have high emotion and other people may respond with silence and nothing. So just to have something in their hand that they can review at a later point in time. Yeah, to just, because there's too much going on in their mind at that moment.
That's right. That's right. I don't usually document, but some people recommend. But I think it's more important to address emotion, as so again, addressing the emotion is most important when you deliver news. And then if they're silent, you have to ask them. So how did it sound? Or like, was it shocking to you? And then, so I always ask, and then they would say, oh, actually, I knew this.
I'm so happy you really highlighted the importance about how providers need to be comfortable themselves with a person that you're present with them while they're silent, and you have to be comfortable with that.
That's right. So silence is also another communication skill, and they teach also. So I mean, sometimes palliative physicians are trained to be silent and then comfortable. So I can be silent even a minute, and then they started crying, or they need time to process the thing. So sometimes it's okay to wait, and then and then if they're still silent or started crying, and then just be there, and then give them tissue, and then do something rather than just talking about chemotherapy or next step.
Yeah.
Thank you.
Yeah, I just wanted to just, I just wanted to also speak to Sarah Tompkinson's comment. I actually like giving a very short, I just write it out on a piece of, nothing formal really, but on a piece of paper with a nice thick pen on large print, and maybe write down like just like couple of bullet points and says, we had a great visit today. We discussed this, we agreed on this, and this is going to really help you, be safer. And then that's it, and then they have a piece of people. I mean, I think older adults like to have a piece of paper
Yes.
to go home with, and then they can show their daughter or their son or something. And it's very simple. It's nothing really extravagant, but large print, easy to read. Yeah, it goes a long way. Yeah.
Yeah, thank you. And also another way to confirm their understanding, you can ask them, so how can you tell your daughter when you go home, about this conversation? Can you, to make sure, and that how I approach is not to challenge their understanding, but to put responsibility on me, meaning, so I want to make sure that I explain well. So can you tell me how you tell your daughter about this conversation? And then if they give you a good summary, I mean, that means that the information has been delivered.
Okay.
Janet,
Great.
you want to say something?
Yeah, I had two questions. The involvement of the loved ones in the family, I think, is always super important. And we find that a lot, is that there's sort of, people say, great, I'll go home and tell my kids, and they don't. So we encourage people to invite somebody to come. Can you bring your daughter along? So I was interested in your experiences with pulling those key people in, because again, we find so much conflict with the family that, hasn't heard a thing about this despite all your good work. And then they're surprised. The second thing, I was wondering, Dr. Uemura, how much time do you advise colleagues to take for this? I'm usually confronted with people who say, well, I have 10 minutes or I have 7 minutes with the patient. And clearly, what you lay out is the way you're supposed to do it. But it does take a lot of time. You get a good outcome. So I was wondering about those two things.
Sure. So there have been, when the COVID crisis happened, let's say in New York, and actually Dr. Nakagawa, we had conversation, and then he works for Columbia, and then the crazy, emergency room full of, COVID patient, and then he said usually less than 10 minutes. Yeah, and then, but still he go over quickly, but it depends on the pressure at the time. So if you're doing the, this conversation, just a phone call, and then make sure you can just go, quickly, you don't have to talk about, negative. I mean, it has nothing to do with cancer. So just to go straight, you're high risk, and then the treatment may not work. And then can you tell me what's important to you? And then based on that, make recommendations. So if you do it, you can quickly do it. But if you have time, and then it is important to explore goals more, you can take more time. So if I do like a goals of care conversation, let's say, when I was working in hospital in the ICU setting, we usually take 1 hour to do goals of care conversation. So it depends on the time strength. Yeah, but it's challenging to do it in short time though. Sure.
Okay, I'd like to take a question from the chat box, and then we'll get to Dr. Kohn. So Naomi Morita asks, given the limited supply of the COVID vaccine, what is the thought regarding COVID vaccination, of vaccinating those who are receiving hospice care in private homes? I bet you've heard that one.
I would like to explore. I would like to use the communication skill and explore question. I wonder though, why you asking that question? Can you tell me more? Or can you unmute? Or...
Dr. Morita, you want to share? You want to comment? Well, maybe
Okay,
she
that's okay.
can't. Okay.
Okay,
Yeah.
can you hear me now?
Oh, wait, she can
Can
hear
you
you. Yeah.
Yeah, sorry. So,
Oh, you're back on mute.
so some of you may know that I'm a hospice medical director, and at the national level, there is this conversation going on, and so I just wanted to hear what you thought, because it's a difficult question to answer, and I have a whole bunch of. So I can see that in patients who are in long-term care facilities or group homes, that's really valuable. But they're in a private home. And then there's this scarcity of vaccination. So some people are asking, well, and their life, they have life-limiting illnesses, and we want to utilize it in the most judicious way. So that question arises. For example, I just have a patient right now who's in a home that her fellow housemates in a foster care home, 2 of them were vaccinated 2.5 weeks ago, and then 1 subsequently died. Just a week after getting vaccination. So you think, well, okay, it was good that the rest of the care home was vaccinated, but what about that, vaccination that could have been used on somebody else? Just curious.
I see. Yeah, thank you so much for asking that question. And I think maybe it's related to healthcare resource distribution and the rationing. And then when the COVID hit, there was a ventilator, limited supply, and then there have been so much conversation about rationing. And then I think my understanding as a particular physician, this kind of rationing should not happen in the bedside. So it's always should be following the the rule, because it should not be our responsibility to make rationing decision. And then so I think I would have how I would approach this. I mean, follow the state guideline, and then if they don't want to do it, that's obviously fine. But I do not want to do rationing based on my value or my decision about future. But either one, do you have any comments?
Yeah, thanks a lot. I mean, I'm doing the same thing. I'm still following the recommendations, and whether they're in hospice or not, or whether, of course, if they're, transitioning and about to pass away, that's one different story. But if, they have maybe weeks to months, I'm still vaccinating them. I mean, well, they go into care homes, so we don't vaccinate, but
and then we
so
don't know.
stop the
Sometimes
vaccination.
and then they outlived our expectation. So
Exactly.
yeah, so I think it's still reasonable to consider vaccinate them, and that if the state guidelines said they can, they should receive, I think we should offer.
Yeah, I agree. Thank you so much.
Yeah, thank
No,
you.
I agree. Thank you. All right. Dr. Cohn, you had a question? Do you want to unmute and ask? Oh,
Hello, can you hear me?
yes.
Yes.
Okay, thank you. Thank you, Doctor, for your presentation. It's been useful. I have a couple of specific questions about the vaccine and the system. And I'll try to be as brief as I can. Start out with what I understand and get to the specific question. And if you're not comfortable answering these, or if you don't know, I'd like to know that too. So, and I don't have to, because I haven't done all my homework yet. So what I have done is I know that if there's any adverse reactions, it's supposed to be reported to VAERS. I know that the vaccine is only licensed under emergency use authorization. I hear that emergency, and this is the question. I'm hearing that the emergency use authorization makes it such that there is no coverage for adverse effects, whether it's reported to VAERS or not, because of its emergency use. If it was authorized, if it was FDA approved, then there would be some compensation available to victims of adverse reactions. But because it's under emergency use authorization, it looks like somehow the insurance companies, or whoever if it's the government, I guess, who's insuring this, which is all of us, of course, they're not actually covering any adverse reaction effects or payments. Is that true or not?
Okay, to answer your question, I do not know, but Dr. Wen, do you know anything?
I don't know either, but I imagine if you had an allergic reaction, went to anaphylaxis, I mean, if you had anaphylaxis from anything else, you ate some shrimp or something, I would think that they would cover that. So I'm not, I mean, it's just, whatever it is, even if you don't know what you ate and you went into anaphylaxis, you would get covered. So I'm not sure. Other
Well,
than
what if you
that, I'm
had a
not sure.
more severe reaction and ended up brain damaged or dead?
Right.
Is there going to be compensation because there is usually some compensation for the family for that kind of stuff, horrible reactions, unexpected. I realize it's not going to be a common occurrence, but I mean, is it programmed that we're avoiding compensating people who are severely injured by this experimental vaccine?
No idea.
Okay, I don't know either.
Yeah.
Were there any
had heard that,
patient
and I
or
don't know if
family
it's
who
true.
asked that question?
I'm sorry?
Were there anyone who asked that question?
Any patients or families?
I'm just
Well, it
wondering.
was actually something I read recently that suggested that was true, and I have not verified it yet. So I don't know if it's true.
I did read that myself.
You did read that yourself?
Yeah, I did read the same thing, maybe about 4 to 6, maybe, I don't know, 4 to 8 weeks ago. I did.
Okay. So that I don't know if I should consider that confirmation that there's, I think there's a problem there, but that's the way it is. So it's good to know that, because if somebody asks, well, what happens if something terrible happens? Well, we're going to revert it to theirs. And what happens if there's, blah, 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 and says, well, sorry.
Yeah. So I
You
think
have
again,
insurance, so
there's so much
you're going to get
information.
coverage for any adverse events because you have health insurance, presumably. So you're going to get your medical condition treated. But if your child dies from it, and which of course is one of the reasons they're not vaccinating children extensively yet. We are not vaccinating children extensively yet, but I just have problems with those issues. I had something else, but I can't remember what it was at this point. So thank you. And if you have anything else to say about it, I certainly would like to hear.
Okay.
Thank you for the question.
Yeah. Any other questions or experiences, challenges that people have?
Janet, I'm wondering if you have any comments or, thank you for joining as a panelist. So I just want to make sure that you have time to say what you want to say.
Well, you did a great job.
Okay, thank you.
I think I'll say a couple things since you asked me. I'd like to remind people that we shared some documents ahead of time. So Kukuamau is a good resource for the state of Hawaii for documents around advanced care planning. So that's where you can download an advance directive and post, as well as explanatory information. And we actually have that in 10 languages. So that's on kukuamau.org. You can go there and get that information. I would in groups like this, I always encourage people to think if they, what Dr. Uemura was talking about is people with more serious illness, which thinking about, who's your agent, what do you want in this time of COVID. But I think it's always important to remember that most people really don't want to talk about advanced care planning. So all of us who are more comfortable with this, our task is to help our families to get more comfortable. So I would encourage and challenge all of you. First of all, you need to do your own advance directive and then try and get your family to do it too. So remember that the resources are out there. And I think doing it yourself, you begin to see what people's issues are. What are the, and Dr. Uemura gave us great tools of how to listen, how to ask those questions. Oh, you understand it that way. Well, okay. So, or tell me more about that. I think one of the challenges I see all the time is that people think advanced care planning and these conversations are going to go super quickly and it's easy. And it is not. And human beings are really concerned they don't want to talk about serious illness and they don't want to talk about death. So I would really encourage all of you and feel free to go to our website and download the materials, and please join our free newsletter that tells you about things that are happening. We, for instance, always start with who's going to speak for you. If you couldn't speak for yourself in a serious situation, who would speak for you? And then what would they say? And Takeshi had those in his slides as well, but it's a totally different conversation than which I've heard so often. At the end of your life, do you want CPR? Who the heck knows? People don't know what CPR is. They don't know what that is. So I think that I'm encouraging all of you, go download the materials, think about having these conversations with your own people. And that also helps you figure out where the difficulties are. And fortunately, the other thing I wanted to say, in the state, there's an initiative that Dr. Uemura is part of to train people in Vital Talk and those skills so that we can train more and more clinicians in this way of having conversations.
Yeah, so just wanted to point out that Michaela just typed in the chat box that we have resources that Jeanette gave us, and we uploaded them onto our geriatrics website. And so you can just go on that one and download all those resources. So thank you. And you can also go straight to the Kokuamau website as well. Sarah Tompkins was asking, how frequent should the provider review the pulse and the healthcare directives with the client?
Yeah, thank you for that question. So actually, I used to practice in New York, and then New York Post, they call Most, actually have a section page that says, oh, I reviewed this with patients this day and then this time. But here in Hawaii, there's no such section. But so when I was in New York, I was reviewing, I think every 3 months or every 6 months, whatever, time I go there, as a fellow to nursing home. And I was reviewing, but I don't think it's necessary. But I think it's necessary when the patient's condition significantly changed, or when the patient lost their capacity, and then, now the, surrogate or POA is the decision maker. And then you definitely want to run by with the person, if that's okay to, because sometimes they feel differently, and then they may override. I mean, which have happened many times to my patients as well. Recently happened also. And then in emergency situation, they override. So whenever you have time, I mean, when the patient is still stable, it is good idea to go over with the proxy or surrogate to make sure that it's okay with them as well.
And I think
that
sorry.
Go ahead,
So
Aida.
I was going to say, and part of, I think, the reason why we wanted to have this talk now, because this is really an opportunity to go over this again, especially with the pandemic and the opportunities for the vaccine, and opportunity for people to express their concerns and their fears and what's meaningful to them. So I encourage everybody to take advantage of this opportunity. And
yes, I agree. And I would say, sorry, just one last thing. I think back to my point before, if the loved ones are not on board and they don't know what is in the pulse, they don't know where the advance directive is, they've never been part of conversations, this is a problem. And we hear this a lot in Hawaii. So I really would, encourage people to think about, how am I informing the loved ones? How am I informing the family about this as well? Kokuamau is always happy to do trainings and talks and help people understand family counsel, anything like that, because we really want people to understand that. And we don't want people to be, tearing up the pulse in an emergency situation because they've never seen it before. So I think we have to be very clear that the family has to be part of the unit of care and unit of information. again, especially in Hawaii. So we want people to do that. I think it's also really important to say advance directive. People can do that, appoint their agent and not look at it again for 20 years. So it's really good that people look at that like, oh, wait, my ex-husband is my agent, not that has happened before. So people need to do that. People need to look at it. The POLST, this living document, that's a care plan. If anything changes with the patient, it doesn't necessarily have to, but it's a good chance to renew it. And people can be hospitalized and still get out and still have the same POLST, but I think it's a really important thing to keep it, to make sure it's what you want. And again, that the family knows about it. So again, we're always happy to do trainings and education and any kind of thing about that. So just let us know.
Jeanette, I just wanted to add to what you're saying is
Thank you very much.
Just to affirm what you're saying, I've actually come across situations where people that are the healthcare surrogates did not even realize that they were appointed a surrogate because they didn't have that conversation with the patient, or someone has died. Several people have died on the advance directive, and now it's like, what are we going to do?
Yep.
Yeah.
So
okay. So I actually need to end this right now. I'm sorry. So and then we could just stay on if you want to just ask more questions. But just to before people go, just want to remind people to get your CMEs, go to the website and click on that link and type in the type of CE you have. And we also put in all your comments for planning for the future programs. And join us next month on March 14th. Our topic will be the geriatric approach to nutrition and weight loss. Okay, so thank you very much for joining us, and thank you for a very excellent presentation. And I'm willing to just keep this open just for a couple of minutes if people just want to have any last minute questions with the speakers and panelists. Thanks.